Hey everybody, welcome back. We are back talking about neck pain. This is our third video. We're going to focus on therapies and medications, some home remedies for you, and even prevention. So I'm Dr. Kevin.
I'm Coach Sean.
And we're the FitHealth Pros. Now, if you didn't check us out on the first two videos, we've done two already. So the first video in the neck pain series here, we talked about anatomy, symptoms, when to get help. We talked about what specialists you may see and even the diagnostic tools that those specialists and those doctors are going to use to help you discover what's causing that neck pain. Video 2, then we went into types of neck pain.
And more types of neck pain.
And even more types of neck pain. So obviously there was a whole video, so there's a lot of different types of neck pain. Now, let's go ahead and get into this video. So let's start with some therapies.
Splendid.
Yes.
Number one, therapies. So first therapy we're going to talk about that's super common is physical therapy when neck pain presents itself. Now, physical therapists are going to work on your posture, alignment, neck strengthening, also utilize ice and heat and electric stimulation like the TENS machines. Also ultrasound and just various different ways to take that pain away, take the inflammation away, and get you back to a normal range of mobility. Next up, what I'm going to call the Dr. Fox special, chiropractors. So I'm going to have, when you have the specialist, you got to use them.
Right.
So, Dr. Fox, will you tell us about chiropractic?
A little bit, absolutely. Let me also tell you that if you would like us to kind of introduce you to these specialists and talk one-on-one. I've talked to a buddy of mine who is a physical therapist, and he's agreed to allow us to come into the office and do a walkthrough. If that's something you would like, hit that like button, give us a comment and say, yeah, let's do it.
That'd be awesome.
So I think that's good. And we can go into foot doctors and all the different types of specialties, whether it's orthopedic and things like that. So I'm gonna do my best because I have a lot of colleagues that do these things, pain management and things like that. So sometimes it's scary, you don't know what it is. Like chiropractic, what is chiropractic?
Yeah, what is that voodoo?
What is the voodoo magic? It's not voodoo. It is based on science and based on physics. So as a chiropractor, we mainly focus on the spine and the nervous system. So by adjusting the spine, we're allowing the nervous system, which goes to all the muscles and tissues, and remember the anatomy, we're talking about the muscles, the discs, and those systemic things that can cause the neck pain. That's how the adjustments can help take care of that. So as a chiropractor, that's what we're going to focus on, is the primary therapy is the adjustment. And there's many types of adjustment techniques out there. I use a couple of instrument techniques, so they're very low force, which I think people like if they're brand new to chiropractic. They don't want someone to, especially when it comes to the neck,
Big crack.
Crack the neck, right?
Right. Big crack.
I would say more often than not, more patients like that. And don't worry, the crack isn't bad. It's just like popping your knuckles. You're getting a fluid release out of the joint space, and it just makes a popping noise. So it's not a bone on bone. It is a gentle glide, and the key really is in the technique. So that's what we've trained to do over the years. The other thing, as a chiropractor, we're going to throw in some of the other mobilities that Sean's going to finish up talking about, but very similar to the physical therapy with the ice and the heat. We do some warm-ups first. We may do some flexibility things to warm up the tissues in the neck, maybe to traction the vertebra to loosen that up. We may do some muscle therapies, some soft tissue, blade work, myofascial release, manual therapies. So there's some crossover with the physiotherapy and the physical therapy, and then what we add to the table, where physical therapists do some mobilization, where they're taking the joint to its end space. We just go a little bit beyond that and let the vertebra then settle to its natural place. And that's what's important there. If you haven't had a chiropractic adjustment, and you have pain, or you've had pain and you feel stiffness, you feel achy, you're sitting at home a lot, I encourage you to go out and try it. Go ahead and get it. You'll be surprised at how great you're going to feel. It's not something that if you get an adjustment, you're going to have to keep going forever. Just like physical therapy doesn't have to be 6 weeks or 8 weeks or 10 weeks, chiropractic can just be an adjustment here or there to keep you out of pain, but make you feel and perform better.
Yeah, and get you in a natural alignment that you don't even realize what that natural alignment is because you've been living just off
Right.
for years.
And
possibly.
if you guys want a deeper dive on the chiropractic, which I think it's automatic that we'll do one,
Yeah.
go ahead and again, hit that bell so you know it's coming. Yeah, we definitely going to provide that for you.
I just picked his brain.
Mm-hmm.
And he did well, that's Dr. Fox. Of course he did a good job with it. That's what he does. So we're talking about the different things that he was possibly utilizing as a chiropractor. Traction is one of them. Now this is a gentle stretching utilizing a kind of a weight and pulley system to stretch the vertebrae, to take away some of that compression, take away the pressure of that compression of basically gravity taking you down, vertebrae on top of the next. The next one I want to talk about, we're going to touch upon it, but it's not nearly as popular as it used to be.
It used to be, right.
Now back in the 70s, you'd be watching like Taxi or some shows like that, and like Andy Kaufman would come in with a big soft collar. That's immobilization.
Right.
So that soft collar, now you're only supposed to utilize it for about 3 hours at a time maximum. And of course, in those shows, they're wearing it all the time, because look, I got a hurt neck.
Right. The law shows and Brady Bunch, there was one.
Yes, yes. So they threw it in all the time. It was a very popular modality, or opposite of modality.
It was mobilization therapy.
Right.
Yeah.
It's an immobilization therapy. So you wouldn't want to do it more than 1 to 2 weeks overall. Nowadays, therapists and specialists are more focused on getting movement as soon as possible. You don't want to immobilize as much as you want to test the mobility of those vertebrae and see how you can get it back to as close to normal as possible, as fast as possible to get that pain out.
Yep.
I want to touch on medications a little bit. We said we were going to talk about these. We don't necessarily talk against them, but we would much rather you go a more natural, possibly homeopathic way if you could, instead of getting medications. But if there is severe pain, oftentimes a specialist may go for a steroid injection, some heavy-duty pain relievers, which of course there are a lot of side effects to that as possibilities, up to and including addiction. Muscle relaxers, antidepressants, which you think, well, that's interesting. Why would they prescribe antidepressants? Well, if you've been in pain for a long time, and especially neck pain, where you have a hard time even moving your neck without having a zot of pain going through, it can be depressing. So it's a possibility that you would be prescribed a light dose of an antidepressant to kind of get you through that time. Antibiotics, in case there's a bacterial infection. Numbing medications. Again, if the pain is that intense, you may get an injection of a numbing medication or a topical cream.
Right.
To take that down quite a bit.
We do that in the office as well. We found a combination. Well, there's a couple of things, and it's in the medication category, but it's also in a therapeutic category, and that would be a trigger point injection,
Yes.
Or even dry needling type of injection. Okay.
Yes.
So there's a couple of different things that when we look at how you should do the therapies with neck pain, what comes first. We want to do a mobilizing type of therapy, like the chiropractic adjustment mobilizes the spine. It's just does wonders for taking pain away. Physical therapy, it's a mobilization technique. So we know mobilize first, then you can medicate.
Anti-inflammatory.
Okay, anti-inflammatory. So the trigger point therapy is really cool. It's been around for years and years, and you can use like a poking device. You can use a thumb. You can have a massage therapist use their elbow and dig in.
Get in there, yeah.
But a trigger point is if you feel neck pain or tightness in your shoulders, within the fibers there's a little knot or nodule, and that has pain sensors, a lot of high, just concentrated. It's kind of twisted with those nerve fibers, and it needs to be broken down. And usually there's a pattern there of years and years. So you can massage. So those who get massages a lot, and the massage therapist is always telling you, man, you're tight again.
Yeah.
And well, I get a massage every week.
Right back.
And it comes right back. Then you have a poor pattern of trigger points. And we specialize in this. And what we find is if we just shoot a little bit of lidocaine or some numbing agent, and you do it in a certain pattern, you can add Toradol, which is liquid Advil. So going back to some of these medications, a lot of them have terrible side effect. Mm-hmm. Toradol, Advil, if you take it orally all the time, has to go through the liver, through the kidneys, and that kind of thing. But if you put it right into the trigger point, it's just anti-inflammatory right to the area. Is there a contraindication? Yeah, it's still going into your bloodstream, but very minute, not like taking a medication. Plus you're putting it right where you need it. What they found is if you do trigger points, and you can do a needling or dry needling, but just the needle going in and out causes the body's natural healing response. So that's the cool thing that we need to tap into. How does the body naturally do this? We've been told everything comes from these outside sources of medicine.
Right.
You have this, take this. Well,
it's a Band-Aid.
It's a Band-Aid, and your body really knows how to heal itself. And as we go along as pain management specialists, these things aren't new. And there are some trendy things and there's some different ones, but the ones that are tried and true, plus how we find how pain works and how people heal, plus we don't want addiction happening.
That's a big thing right there.
This has become more accepted.
Huge.
You know, the more accepted was taking a medication that was a $5 copay. Well, when the copays are $50 and the medication causes an addiction, boy, we start looking for different things.
Yeah.
So these therapies are good. So then what's last? So we had the mobilization, the get rid of the actual cause of the problem, maybe with a numbing or medication, and then the last course of action
would be surgery. Yeah. So for compression itself in the neck, surgery is pretty rare. But if there are issues where there is no turning back, you know, there's no way to plump that disc, there's no way to create space naturally. Sometimes surgery is that option.
Right. Watch video number 2 on the types of pain: spondylosis, spondylitis, osteoarthritis, any of those things that are changing the bone, changing the disc, whether it's prolapsed or herniated, it's irritating the nerve. Numbness, tingling down the legs. Well, we're in the neck, so numbness, tingling,
and
weakness in the arms, fingers, carpal tunnel, all of those things. Last course would be surgery.
Now there are some other therapies. I'm gonna throw them out here. Acupuncture, rehab specialists, osteopaths, massage therapists, like Dr. Fox was talking about just a second ago. And when we're talking about the different types of arthritis, rheumatologists as well can help tamp down the arthritis. Now, it's not necessarily going to go away, but it can be managed, and rheumatologists are fantastic for helping to manage that.
Yeah.
So, let's go into home remedies.
Home remedies.
Boom.
Now, home remedies, I think that's what the majority of people are going to do at first. If you have a new pain, you wake up, you slept wrong, so you say, you're going to first try just to relieve the pain naturally.
And give yourself a set amount of days. Well, I'll do this for 2 or 3 days, and if
Right.
it doesn't release by then, I'm going to see somebody.
Absolutely, yeah. Now, yeah, with that said, if it goes over those days, usually, like you said, the set amount of days, you guys can determine what that is. But as a professional, if you've had something where it's been months and it's reoccurring, see the specialist.
Chronic.
If it's been a couple of days and severe, see the specialist.
Mm-hmm.
If there's been a trauma, go ahead and rule stuff out. It takes very little. I just had a patient of mine refer her son in who was in a car accident, and he had no symptoms. We looked at his x-rays. They looked pretty fine for his age. Second visit, he had no symptoms. We're looking at 3 weeks in at this point. Is he going to get anything? Probably not. It's usually within, if an accident's going to get you, it's going to be two days later to 2 weeks later, it's going to build up. And he kind of passed all those tests. And so we released him. So, that was one of those cases where
You can rule it out.
you just ruled it out. It's like, so she did a good job of making sure he was taken care of. And that's what you should do, rule those things out. So if you're at home, I like ice first. So you put a little ice on there, do an ice pack. Don't put frozen peas right on your skin. It will burn it.
At least a thin towel.
Yeah, thin towel, t-shirt, something like that. Mm-hmm. Put that on there. Just 5 minutes is really all you need. 8 minutes max, or until the peas melt a bit.
You can have them for dinner.
And then you can have them for dinner.
Like peas and carrots.
Then wait about an hour. The blood flow is going to come back in. It's going to calm down. You're going to feel more range of motion. So ice is just amazing. It's an anti-inflammatory. It warms up after you take that. Now you can contrast that with heat as well.
Sure.
So say you got in a little fender bender, or you were at the amusement park the day before and you're just stiff. Your neck is real stiff, or you woke up and the cold movie theater the night before got me. And hopefully it didn't get the other 150 people in the theater.
All looking up.
But
The only seat is the front row.
yeah. But you're stiff. You can use a little heat. Take that hot shower, let the steam build up, get that heat on there. Now start gentle mobilization. And again, we're back to mobilization. You can also contrast that back with ice a little later in the day. And it's just fantastic. If you find that goes away, that's really what we're looking for.
Yeah. That home remedy right there, where you don't necessarily need to see someone, and that'll take that inflammation down in a day or two max.
Yeah. I think there's a natural inherent thing where if we have neck pain, we're going to grab it and kind of self-massage. Mm-hmm. We call that kind of an innate tendency where we don't even think about it.
It just automatically goes there.
Just do it, right?
Oh.
So any of those type of things where you feel naturally like, oh man, it feels good to look up. Oh, nope, doesn't feel good to look down or up. But man, it feels good to look down and just to pull my head out and stretch that. Any of those things that you feel that naturally feel good to you, do that.
That's interesting, because I tell my clients that all the time.
Yeah.
And sometimes that's how my sessions will go with my clients, is what's your body telling you?
Yeah.
Listen to your body. Your body doesn't lie. It'll tell you what not to do quickly, but it'll also give you the hints of what to do as well.
Yeah, so that's a good one. If you're doing any sports and you're actively participating and you have that neck pain, ease back into it. Make sure you have a good warm-up. Make sure that you can do the movements gently first. Don't just go into the quick bursts and looking up when you're playing basketball, or quick turns if you're catching a football, those type of things. So with sports, ease back into it.
Big time.
Listen to your body, and then guess what we got now? So here's the way we prevent this stuff.
Yeah, we're looking for you not to get hurt.
Yep.
Okay? We appreciate the business, don't get me wrong. But but we'd rather you not be hurt in the first place. So with prevention, first and foremost, when I'm talking about prevention, I always go into good posture. We're looking at shoulders with a straight line over the hips, ears over the shoulders, and when you say those two things, look at this guy.
That really
Look at that! Look at
helped
that
me out.
posture. He's like, look at that. He's at his full height now. I'm feeling really short. So, focusing on good posture is huge, and those two things that I told you just now will automatically put you there. Now that's generally for standing, walking, sitting at a desk. Those things will always keep you in a straight line and keep you upright. And as you can see, that neck is straight up and down. It's not at a perilous angle. It's not in a position where you could possibly get a crick or get some kind of inflammation started there with a compression. Now, in also talking about your workspace, you can also adjust your workspace when it comes to your chair. You can go out there and get a fantastic ergonomic chair for your desk. Dr. Fox and I have talked about this before, that you can find a great chair for not that much money, or if you want to spend more, you can get a fantastic chair too.
Yeah. Give
But
a shout
test
out
it
if you want us to tell you about some cool chairs.
Yep, we can definitely do a video on those as well. It's just being able to sit upright comfortably for the amount of time that you're in your chair does wonders for that neck going straight up and down, like I was talking about earlier. Also with your monitor, get a good monitor with set your brightness at a good level for you. You don't want it blurry. You don't want to be squinting at your monitor. Getting that hunched shoulder. You see that a lot at people working at desks, where you get that office hunch over here, and you're squinting, and you're super focused, and as if you couldn't focus up here. Your body will naturally go there, and as you can see, it puts that neck into a perilous position for a possible injury, especially over time. Also, desks. You can get a standing desk where you are sitting, you hit a button or you raise it up, and it becomes a standing desk. You can utilize that throughout the day. You can switch back and forth. It's so much easier now to be able to switch from a standing workstation to a seated workstation.
Yeah, and they have all price points too.
Technology
So you
is
have
fantastic.
the full desks. You have something that you can put on your desk that's already there.
Yes,
So they
my wife
made it-
actually has one of those for the house.
They made it so you can use it at home.
Yeah, it's fantastic. And like Dr. Fox said, you can get at various price points, so you're not spending an arm and a leg unless you want to. Next up, which is very important, take frequent breaks. Now, oftentimes when you are in the middle of something very important for work, you may get sucked into the rabbit hole, and you are there for hours at a time in one position, in that super highly focused, I'm going to get this done, I know what I'm doing, and I'm going to impress everybody, and I'm going to be a star. Well, you can still be a star and take breaks, and you can take breaks and still be a star. So I would say every 40 minutes or so, hour max, get up, stand, stretch, walk around, get a snack, a healthy snack, because we're FitHealth pros. So that'll help. That'll help quite a bit.
Watch our healthy snack video.
Yes.
No, I'm just kidding.
Ding. Yeah, that's another video. Who knew? But get around and if you have to ask a question to somebody, go old school and actually get up and ask them instead of instant message. If you need to get up, get up and go ask them. If you're in the break room, that's a great time to ask questions and just be away from that desk.
Yes.
Unchain from the desk a little bit. Next up, which is something that's not as popular as it once was, thank goodness, is smoking. No smoking. Smoking is so horrible for your heart, so horrible for your lungs, and it really does have a compounding, compressing effect on your body and takes you down over time. It takes your energy away, so that it's really hard to keep that posture upright because you're just too tired. It does take a certain amount of muscles to keep that posture up. So no smoking. Next up, this goes for guys and ladies, avoid heavy shoulder bags. So this could be purses, this could be gym bags, this could be computer cases for your laptop. Don't overload them with stuff. If you do have that on your shoulder, it's weighted down, you are going to be leaning. You may not lean that much, I mean, unless you got a couple, 15-pound dumbbells in there, which I have seen.
Yes.
But it will take you to a certain point, and your body is going to compensate. And as you can see, my neck is here, and this angle is lower here.
Right.
And in doing so, that can create over time a tightness in the trapezius muscles, underneath the scapulae, and also put a compression on the neck vertebrae as well, the cervical vertebrae as well.
Let me just throw another example, just for those of you who don't believe that the bag will pull you down, because you do have to have quite a bit of weight to pull down.
Sure.
But here's what happens, I think, more often, is that it's a heavy bag, but it's only 10 pounds, 8 pounds. So you put that on the shoulder, what happens is you do this. Right?
So you go the other way.
So you go the other way. So
Interesting.
that's really what happens when you have if it's real heavy, you're probably going to kind of slug it around until you get to the car. But what happens more often than not is someone's carrying a bag that it's not heavy to them, but you're doing this.
There's a natural response because you don't want it sliding down your shoulders, so you're going to up it.
You do this, and then the neck goes over to the side, or you go here. What's my hip doing? It's going over here. So
And then the whole,
yes.
all the way down.
So keep that in mind.
All the way down. So last thing I want to talk about is something that doesn't get touched on that often, but that is the sight line that you're using when you're walking. Oftentimes when we're deep in thought, we may be thinking, when we're thinking, we're looking up to one side or the other, depending what creative and intellectual side of the brains, or you're just looking at the ground. You're walking and you're hyper focused and you're looking at the ground. Well, guess what? You're creating that hunch. You're creating that same hunch that you had at the computer. So that's putting that neck again in a perilous angle for possible compression issues and inflammatory responses, because the body does not like to be like that. The cervical vertebrae do not like to be in that curve. So it likes to be straight up and down like that. So focus on your sight line out, up and out. So even if you're thinking, you can do that with your eyes. You don't necessarily need to have your chin up when you're thinking. You don't necessarily need to have your chin down, but keep that sight line up. You can look to the side or the side when you're thinking, but it's something to think about as well. And it's, again, not touched upon enough, but you see it all the time.
Well, I think that's awesome information about prevention, and that's really what we care about is, all those little things, they definitely add up to major things for prevention and keeping you out of that injury state, the possibility for injury. Because when people have these pains, they don't just get up one day and have a pain. It's something that's accumulated over time.
It's built up, yeah.
So if you like that, definitely smash that like button, subscribe to us. The more people that do that, the more of these videos we can put out and help more of you.
People. More
Absolutely.
people.
So I'm Dr. Kevin.
I'm Coach Sean.
And we're the FitHealth Pros. And thanks for joining us. We'll have more videos coming up in the future. We're going to continue our pain series. We're going into shoulder pain and some knee pain. So definitely hit the bell and subscribe. And we'll see you on the next one.
Thanks, folks. Bye. Adios. I did have a client, what really got me thinking about that was a client of mine who refused to look down, because when she would be walking at the park, she would do laps around this park, and there were so many people that had these hunches as they started aging. You get the bone density issues, etc., and you become the habits that you create.